I'm happy to see the faces that I know, and we are glad that we are here together to have a conversation on investment.
Your presence here as partners and all the dignitaries speak volumes. It tells me that we share not only a vision, but also a commitment to our region's future, because we need to invest in our future, and those are the children. We know that the future begins at every start of life. And most of the times, that is the most important early stage of human development, the early childhood development. By being here today, you are affirming that every child deserves the best start possible. And the future of our children, indeed, is in our hands.
I want to look at this topic from the lens of faith, from the lens of social action, from the lens of practical engagement. Talking about ECD, it pricks me if it becomes a secondary issue in our life. As a bishop, sometimes I go to church. Or not sometimes, I always go to church. Because if I say sometimes, you may be asking me to account for the other times. Children are there. And immediately I come, children are whisked away. The belief is some of them are going to make noise. And when Bishop is around, there should not be any noise. I always insist that all children must be brought in front of me and seated before adults sit. That is one of my policies.
We are asking ourselves that if children attend school when they are 3 years, what is the impact of that on the preschool, on their preschool readiness? What is the impact of that? And we are also asking another question. Go down, my friend. That what is the impact of the preschool curriculum intervention that enrolls 3 years old? What will it have on time use for the mothers? So reflect about that, because that is the message today. We are nurturing care. And what does nurturing care mean? Nurturing care means that we have to provide some space for them.
We came together so that we can support the governors achieve their mandate in taking care of the people of the region or of their counties. And we touch the soft spots, the parts that they will not go to. We look for the vulnerable within the communities. We have therefore crafted programs that address that. Programs in health, programs in community empowerment, programs that target the disabled, programs that target the youth and the children, programs that also target food security. So allow me to just read my speech now that I have given you a preamble of who we are. I want to take this opportunity to appreciate the organizers of this event at the 2025 Devolution Conference. I also acknowledge you for your presence here today and participation in the various events organized. This year's Devolution Conference calls on us to leverage the available platforms at the county and national levels to strengthen structures aligned with its theme, for the people, for prosperity, devolution as a catalyst for equity, inclusion, and social justice. Specifically, we are called towards reengineering county governments to accelerate development and close the socioeconomic divide, with a goal to examine the role of devolution in the realization of equity, inclusion, and social justice.
In Kericho, we said we need a resolution, and incidentally, Mama Rachel Ruto was the guest of honor, that you don't give sanitary towels during political times, because menstrual hygiene does not only come during politics, it is throughout. So we need a policy to ensure that government and our institutions that are responsible for providing menstrual hygiene towels, sanitary towels, do it throughout the year, because these things are done throughout the year.
I sometimes am excited when I hear one of our people is required to go to Brazzaville in Congo, in Dar es Salaam, and of course the Mozambicans who came to Siaya. And more importantly is the subject we are dealing with is about our children. If we don't give them a smart start in life, then society is condemned. The beginning of life, as spelled out in our constitution, the beginning of our life starts with that age from conception, not from the moment you're born on the roadside like the bishop. And by the way, what the bishop was telling us is a story, because he could not have known what was happening. Yeah, but he was already a human being. So the first 3, 4, 5 years, all of us in our lives, the characters that we have, that formation started when right at conception, but more particularly after you have been born and you start engaging with the family, with parents, and with the community at large. So this is a responsibility that we cannot run away as a people, as a state, as the Republic of Kenya, because those who we bring up depend on how we start with them at the time when they are born.
We're experiencing quite a number of different formations of families, and we know for early childhood care and development, for children to thrive, they need safe, stable, and nurturing environments. So what are we encountering? Grandparents taking care of young children because the young people have gone away for work or are engaged in other behaviors. We're experiencing a lot of adolescent motherhood, and that comes with its own various risks. We are experiencing blended families. I come with my child, you come with your child, we get a child of our own. We are experiencing polygamous families. So all these family formations come with a lot of issues that need to be addressed when we are talking about nurturing care. The previous speakers have talked about parental well-being. If parents are stressed, they are depressed, it doesn't matter how well our services are, because they will not be able to access those services. So what kind of solutions are we advocating for? In addition to health and nutrition, understandably, they've been the biggest investments in nurturing care. We are looking at responsive caregiving and opportunities for early learning. And we're looking at integrated services that add parental capacity, parental support, so that parents can be in a good space to take care of their children.
My question is, how are county governments adopting and implementing the Persons with Disabilities Act? Where does this sit within the structure of a county government? Who is the CEC or the CEO who is in charge of this, so that they can push forward what we need to do with our persons with disability and to promote inclusivity? Yesterday, when I was sent the poster for this panel, I posted it on my WhatsApp status, and one of our MCAs who is disabled from Kirinyaga County gave me a message to give the people in this room, that actually when it comes to early childhood development education, we have completely ignored our young persons with disabilities. For example, because I work very closely with the deaf community, a young deaf person only gets to go to school at the age of 7 years. This is something that is very worrying, because something that we forget is from when we stay at home from 0 to 3, we're actually developing language. That is where we learn to speak. We're engaging with our parents, if somebody has siblings, with other members of the community. But for a young deaf person, when they start school at 7, they have to begin by learning the language. So this becomes very difficult for them, and that is why ECDE would be a great solution. But it comes with a lot of strings along that, let me call it a value chain, because the best way for a deaf young person to learn is from a deaf learned person, or a young blind person to learn is from somebody who has walked that journey, who would be a blind teacher. So again, how have we incorporated the teachers and the learnings? And even from the presentation of Daktari, which was very good, about the case study they're doing in Tharaka Nithi, there was no inclusion of young persons with disabilities there. So the first step of promoting inclusivity begins in this room and our awareness that young persons with disabilities, blind, deaf, those dealing with physical disability, they actually have not yet been given that space, in as much as we have signed in something into law. And the first statement of the law indicates that we outlaw any discrimination to people with disability in regards to education, employment, and health.
All our teachers, courtesy of UNICEF, who have now been, all of them, we train them on nurturing care. 2 days, all teachers, and they were so excited, yeah? And we're saying, where has this thing been? So all our teachers right now are very sensitive. Now what they have done, they've gone back and now they are taking opportunities to talk to parents, to talk to talk. You know, a teacher, I was a teacher and I'm a kindergarten teacher for that. That's where I began. And so I know that as a teacher, I taught a child, the firstborn, I taught the secondborn, because I develop a relationship with the parent. Because when they come, you ask them, so, hey, there's another baby coming, so we'll talk about the baby. And I know that baby becomes your baby. And so teachers have a powerful way of even talking about nurturing care to the parents. So we've trained all of them, so to help the health promoters on that. We've also, courtesy of UNICEF, we had a campaign called Kuwakocha, where we brought back all community involvement, CHVs, county government, national government, social protection, children's society. And we trained them. So there were 25 TOTs who were trained. And then from there, we ended up training other trainers. So we had 1 week, like 2 months, we were running on all radio stations within the county. I was there. If I'm not there today, Director, thank you, Director Barasa, he's there. The next day we are saying, who from Commission can go, they are there. We called the county commissioner, can you give us someone? So it was like a concerted effort to talk about nurturing care within the county.
We've ensured that all our mothers attend antenatal clinic visits. We also have safe deliveries at maternity and also follow them through postnatally. So how have we done this? We have empowered our community health promoters to be able to identify pregnant mothers at household level during their home visitation, and then refer them to the nearest health facility to initiate antenatal care clinics early, so that they're able to get the antenatal profiles and all the examination and investigations done to the pregnant mothers.
So I really want to thank our leaders, LREB and the partners, for bringing this to the table so that everybody sitting here has an understanding of what nurturing care is. Nurturing care basically means giving our children in the first 1,000 days the best. So that builds the future of this country.
The impact evaluation enrolled 642 primary caregivers and their children that were aged between 0 to 24 months across 64 villages in Ndiwa sub-county, that is Homa Bay, and of course Bunyala sub-county in Busia County. Half of the villages were assigned either intervention or either an intervention group or a wait list for for control purposes. These were done at the baseline and of course at the end line. And the process involved in-depth interviews with about 58 respondents. That included group facilitators, mentors, caregivers, and of course focus group discussions with multi-sectoral teams that most of my colleagues have talked about. These were meant to examine program implementation, to understand the underlying factors influencing program delivery, and of course the quality.
We call upon the Council of Governors to actively engage the national government to amplify the nurturing care for early childhood development agenda, positioning it as national priority and a shared development target across all levels of government. To document best practices from the Lake Region Economic Bloc and create structured platform for learning and replication, facilitating scale-up across counties through inter-county dialogue, knowledge exchange forums, and national level policy influence.